And I'd like to do opening roll call. Go ahead, Susan, start.
Cole here.
Kim Swaney here.
Chuck Kingsley here.
Michael Chaffee here. Chip Jackson here.
Okay, let's do Pledge of Allegiance real quick. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Perfect. Let's see, do we have, let's see, we don't have any public attendees. Well, I guess you guys want to introduce yourselves, go ahead.
Taylor Harris, the new Assistant Director of Accreditation and Quality Improvement.
Dustin Gass, Clinic Manager.
Okay.
Cindy Gallagher, HR and Finance.
And you guys, we already know you guys. Okay, so can everybody review the minutes from the last meeting? I've already had a chance to look at it. Anybody have any questions or concerns?
We accept the meeting minutes from January as presented.
Do we have a second?
I second.
Okay, Kim seconds it. Okay, Susan?
Yes.
Susan? Sorry, Kim? Sorry.
Yes.
Me, yes. Mike?
Yes.
Kent?
Yes.
Yep. Okay. All right, so now moving on to old business. Andrew, if you want to run the show now.
So for the unified facility update, you actually have, it was not in your packet, so it should have been on your tables, but there's something called straw pay application number 14.
Yep.
Cost breakdown, that would have been the top sheet. The actual pay application is underneath. It is for $63,977. So I broke it out just so everyone would recall what it is, because we haven't actually had a pay application since July of 23. So this is the final payment to Straub, which is the $11,615. And then the change order, which is the sound installation, which the board approved, the exhaust fans. Then I don't know if you remember when we had that discussion about the exhaust fans, we had 2 new exhaust fans that were installed, but they were hardwired to run 24/7. And we elected to get those rewired. And the board basically gave the director the ability to go up to $3,000 to rewire those 2. It actually ended up costing $1,059. So
Per unit or total?
total.
Total, okay.
And then the other thing was an ad that I requested from them, which I talked to you, Dr. Kingsley, a little bit, was wireless thermostats. So basically, instead of us having to go all the way around the building and look and see, we can control those from our phone or from the computer.
And then how much did that cost?
2,426.
Okay.
And in this packet, just so in case anyone's wondering, I did get a separate quote from that from a different company, and it was $4,025 to do the same ones.
So better.
And so it seemed to me like, because of all the HVAC issues we've had, I didn't want someone else coming in and then being able to point fingers. So I went ahead and had them do it. And it was kind of a limited time thing. It was while they were here doing the other stuff for us. So I just said, do it. So if anyone has any questions about that, that just made sense. And I know I did talk to you about that in our meeting, but again, it was already a done deal. So.
Right. So tell us finally, so the new 2 units that you put in, the they turn out the thermostat, but they turn on with the lights, or how do they actually?
With the lights, just like everything else.
So for 12 hours a day or whatever, they will be on, and then at nighttime they shut off.
Right.
Okay.
So just ask the board to approve this pay application. It's actually on the list of bills tonight.
One question. If we pay them all the retainage, are we sure that they are no longer responsible for making sure that HVAC issues are adequately addressed as we approach warmer months?
So we still have the warranty. It's in writing that it's been extended. I mean, they have been trying to work with us through their hoops and stuff. I believe that they will take care of us.
It's extended till when? When's the deadline?
September, mid-September
24 or
Yes.
25?
of 24.
24. So we have 3 months essentially of summer to figure that out.
And we'll know by June 15th, probably, if it's not working.
Okay. Who has access to the thermostats, by the way? Is it just you two be running it? Who's actually gonna be doing that?
It will be Dan, myself, and Frank, our new maintenance person.
Okay. All right. All right, we need a motion.
Oh, I guess one other thing Dan wants me to point out, he could have pointed it out, and that was, with the exception of me spelling grant wrong at the bottom, the 41,803 and the 1,059, that is actually going to be reimbursed to us through a grant through Missouri. Well, it's through the Missouri Department of Health and Senior Services, but it's actually a federal grant. But so the net to our actual citizens will be about $20,000.
Okay.
I make a motion that we pay this bill.
Okay, a second.
I'll second that.
Okay, Susan?
Yes.
Yep.
Yes.
Me, yeah, Mike,
Yes.
Ken?
Yes.
Yeah, same deal.
So
And then, did they send us in writing that we're all paid off, we're all good, everything's finalized?
We'll sign a lease waiver,
Okay, good. Make sure we have that. Good.
it'll get recorded,
lien waiver,
I believe.
lien waiver, lease waiver. Thank you.
I believe it'll get recorded too.
Okay,
So the next thing is the Family Healthcare Clinic RFP. That is actually the 2 big packets that you have on your desk or on your table. The deadline was today at 5, at 6. So this is it. These are, we have 2 different ones. And so if you want to open them,
I'll do right now I'm doing the Samuel Rogers, but do you have like a slider? I don't want to tear into this and make a mess.
every other day I remember.
Back, come back. Oh, no, that's.
I don't see it. I could do this other one first, maybe.
Took my leather right out of his jacket on the trip.
Okay, I'm gonna do the slope one first, I guess. Slope health service.
Did you start with the easy
I'll do
one?
the slope one first, yes. Yeah. You wanna do this? Yep. All right. So, let's see what they say. Okay, so SWOPE Health Services. Let's see, they say, what is it that you want specifically though? Do you want operating income or what do we want here?
I probably at this point just want to know who submitted the RFP.
Okay, so it's,
There's a lot to digest in
I was
there.
gonna say,
and
okay.
Are you gonna review that tonight?
yeah, I was gonna do it like right now.
Quick report.
Yeah. Okay,
That's what I told him earlier.
so this is from Namish Patel, who is from the SWOPE. What do they actually call this? The SWOPE, I guess, yeah. So we reject their bid, but we want.
So I think we open them all, just say who they're from,
Right,
and then we'll reject all proposals and have them sent to staff for review
Okay.
or to the RFP committee, to the Family Healthcare Committee.
okay.
Which so
That'll be us two, right?
Yeah.
You and me are doing that, right? Yeah.
Well, I believe that's what we just.
Whoever wants to do it.
Okay,
Well,
so
I know
there,
Dr. Chape is definitely one,
I'm going to participate.
yes.
okay, so each one of these is the same, you said, right? We just have to open one?
Yeah.
Okay. Okay, so this is from Samuel U. Rogers. This is from Bob Thies or Thies, Chief Executive Officer. So this is the response to the RFP.
What is his first name?
Bob, and last name is Theis, Theis.
Okay.
Thank you. So I guess we need to make a motion that we reject it and then second it and then
Yeah, just make a motion to
I'll make the
reject all
motion.
the proposal.
I make a
And
motion
send it
that
to
we
the
reject it
committee.
at this point, but we have our staff look through the proposals and then we reassessment at that point, and bring it back to the board for final decision.
We need to open all three of them first.
Yeah, there's three of them?
No, it's just two.
Just
Just
two.
Just two?
One of them came in 2 packages.
Oh,
Yeah.
okay.
So there were 10 different, so they put them in 2 packages, 5 and 5. Okay, is that a good enough motion or what more do you want?
Yeah, I think just the motion that reject all proposals, send it to the RFP review committee for a recommendation.
So it's, and then review, okay, to the RFP for recommendation.
Right.
Okay, do I have a second?
I'll second that.
Okay, Susan seconds. Any further discussion? Anyone? Okay, Susan,
Yes.
Kim,
Yes.
me, yes, Mike,
Yes.
Kent?
Yes.
Okay, done deal. What timetable do you want before we have to make a decision?
It is on there.
We've got till March 21st.
Yeah, I believe so.
Somebody read it.
Dan has it up, but we're going to make a recommendation by the 18th. Or the committee will complete their analysis by the 18th,
And present that at
March.
the board meeting.
and then the board will make a decision on the 21st.
Okay. There we go.
And so you'll be getting some appointments shortly for us to meet. Yes,
So will we be getting information to, so when, in other words, if we're coming here on the 21st, we have seen nothing. We have something.
it'll be in the board packet. So
Which is also only a couple days ahead of time.
So
what's
is it
that?
gonna be like the high points of what each, I mean, is that how,
There's like a
So I don't think
format.
Dan has,
I saw
Yeah.
the format, is that, yeah,
but there is actually a whole tally sheet
Yeah.
right,
that you will get in your board packet for March.
okay.
And I think what the committee, I would like the committee to, what maybe as a group can agree on is the committee gets these, reviews them, assesses them, and puts into the minutes at least a couple days in advance, like an executive summary and recommendations,
Mm-hmm.
Yeah.
Okay,
and with some basic support, not an exhaustive report,
Right.
but basic report of recommendations and briefly why with the supportive material. Because I was gonna ask, is the thick one over there, is that one copy?
It's 10 copies.
Okay. All right, I would request if we can at least get those scanned in an electronic format. Might be easier, or I mean, I can take one or whatever, but well, I can scan it at home. That's all right, sorry.
How much time do you guys think you'll need to collate everything?
It looks like not very long because, this one is the original, so it's just that thick.
Oh, okay.
Yeah, I think we could probably have that to you, definitely by tomorrow.
Okay.
That's okay. And if you want to maybe take one home,
Well, they can take them now.
yeah.
Okay, that's fine. I didn't know if you wanted to keep them till
Yeah.
the end of the meeting.
Yeah.
When do we want to do our meeting then?
That will come out early next week. We'll let you know.
Okay, and you think you'll be around? I should be around.
Well, I will be out of the country from the 3rd to the 10th of March,
Okay,
but I'll be working remotely.
but we could do it this one.
Love to.
Yeah, that's fine. Okay.
Maybe easy.
I hope so.
We can't be just the board, I mean, the plant managers, staff, everybody.
Sure.
Can you let her do that? You can drive.
Pretty much every.
Cindy, you'll put that together.
okay,
I need Dan to drive
drive,
because I don't
okay.
know exactly where he's at.
all
So
right,
whatever day that we decide to do this RFP meeting, make sure it's on the calendar so that if the other guys wanted to show up, we have more than 2 people, that it's okay.
Okay.
Yeah, so just make an official meeting, whatever it is.
So Cindy Cogan, I don't know if you heard that, but whenever we set up the meetings for, and I think it might be multiple meetings, whenever we have the RFP meeting review, we just need to post it. Just talking to her,
Yeah,
so she knows.
just make it official. That way, if you guys want to show up, you have the time. Because I'd like to hear everybody's input, Ken, me too.
Yeah, I think it almost should be a special meeting.
Yeah. It's a big deal, so. just make sure, like what Mike was saying, all the ancillary staff is all there
Yeah,
too.
that-
I want to hear everybody's opinion.
I think everybody, we're the director, deputy director, clinic manager, Janice.
All those folks will be there.
Yeah, they're gonna be able to weigh in a committee setting, but if the board wants a separate special meeting to take action on it, that's fine.
Yeah, so we can have a meeting just to hear everybody's opinion and all their breakdowns of it. And then we can have our own special meeting to kind of get all that data and see what we think about it. We could do that as well. That works for everybody.
Yeah, I just know that my goal is to have the staff and the directors make sure their perspective is heard.
Right.
Absolutely.
Okay.
Yeah, I think probably we'll post the meeting, and if you want to show up,
Right.
show up, just know that, and I know Susan, you and Dr. Kingsley experienced this the other day, just know a working meeting ends up being a working meeting, so there may not be, like, I know Dan and I toss some stuff back and forth and different things. It just is not going to be all ready to go.
Right,
We'll be
absolutely.
working towards those decisions.
I think the goal is to have a working brainstorming committee style of meeting
Dialogue,
without as much formality. It's just,
right, and you've been actually, when we were doing all the bylaw stuff, both of you were, that's what I'm hopeful this meeting will be.
I agree.
Appreciate it. Thank you.
God bless you.
Okay, what else? Are we done moving on, or we got anything
I
else we
think
need to
that's
talk about?
everything on the RFP, if you want to move on to the report.
Okay.
So I think Dr. Jackson had asked me to make the graphs a little more, like, especially at the end of the year, that just looked like a bunch of lines. So I only have January, but I made it bigger for the current year. So you can at least see the one dot, Dr. Jackson. But if you'll go ahead and scroll down.
Best January ever.
So far, yeah.
So,
That begs the question, why is that? I mean, he's right. Why did the numbers go up?
you know, I couldn't exactly say, but maybe more people were just sick this January, you know, coming to the clinic. I'm not sure. Overall, they didn't go up that much. So, but they did go up.
Yeah.
So they went from 80 to 100, but in 22 they were 100. So because this is just looking at Medicaid, that graph. If you look at the monthly totals, it's not that much of a difference. Scroll down again. Dustin and I went to a meeting, keep going, last week.
Yes.
The Northland Healthcare Access, that they're the folks who provide funnel through money through the Kansas City Health Tax Levy to help provide funding for the family health care clinic. They also provide money from other sources. They kind of wanted an update about what we were doing and why we were doing it. So I believe several months ago, maybe September, I gave this board a presentation just about a history of the family health care and a little bit about the funding and how much we were using out of tax levy dollars for individual patients. And so that was largely the discussion. Dustin, do you have any comments on how you thought that went or what? Because they did ask some specific questions related to funding and how we have, why now we're changing course.
No, I think it went very well, and I said, Ingrid said, like, answered a lot of their questions. They felt a little bit better about it and kind of understanding why, and they could, from the presentation, they could see why we're moving in this direction and why it makes sense for us. I do know that they did say that some of these entities, they work with in different capacities, so they're hoping that continuing that same continuation of care moving forward will be something that we can still work towards. And so
I don't think any of the, Dustin had changed some of the graphs. or I guess we worked on it together, but we had changed some of the graphs to really represent the deficit in the funding versus what the income was. And just being up on the screen, and they had Zoom too, but it was really telling, just like, if anyone thought that clinic was paying for itself between insurance and grant funding, they really understood afterwards that it was not.
Yeah.
And that it was,
We're losing what, 300 plus per patient or whatever.
right,
Did they choke a little bit when they heard it?
to serve about, what'd you say, 500? Some, do you remember, Dan? Do you, Dustin?
Yeah. about that.
Did they have any say on what they thought of Sam Rogers at Cliff County? Did they say anything about that?
So, no, because we don't want to favor anyone.
But that's already in place. I was just curious if they had any opinion about
So,
switching to a.
well, I don't think
different group.
they wanted to favor anyone either.
Mm.
But what they did say was they have working relationships with the two major FQHCs
Mhm.
in the community, which are those two, and that they'll be able to work with anyone.
Okay.
And they asked me, what did I tell them about Northland Healthcare Access funding? And I said, well, I promised them nothing. However, I did tell them, whoever comes in and takes over, you all will want to have discussions with them and would be interested in at least talking to them about how you could work together. But I think that's what they wanted to know, was if I promised anything, or, and I'm like, that's not my place to do
Sure.
that. We're going to foster that and encourage that, but ultimately that's an independent entity and they'll need to make that decision.
But they have a good working relationship, you said, so that's,
With
I
both.
think that's good. Okay. So no major concerns?
No.
Okay, excellent. Okay.
Go ahead. Scroll down. I think I covered most of the exhaust fan stuff. We did have, in these big buildings, you have a water recirculating pump for the hot water. And the one we had seized up, so we weren't getting hot water in the clinic. The clinic now has hot water. So people are happy to be able to wash their hands with hot or warm water.
Don't have to run 20 gallons to get it to warm up now.
You know, I was testing it. It never, like, I ran it for like half an hour and it never got hot
Wow,
Before they fixed it.
before.
before.
Okay, good. I was gonna say, if it's doing it now.
No.
I failed in the closed, not in the open.
Right.
Yeah.
One thing just going back to the previous topic, Cindy Gallagher always does a good job about it. But in our meeting, you know, one of the things that Northland Healthcare Access did say was they have always been impressed with the staffing that we have and the care the patients get that come here. And I know going through this process for some of the staff is especially hard. So I just want to make sure I acknowledge that.
Sure.
You can go ahead and go down. I won't talk too much about this. I do know that I think Taylor introduced herself to everyone. She started on January 23rd. She has jumped in with both feet. We are now registered with FAB, so they know we exist. So the National Accreditation Board knows we exist and that we are interested in accreditation. Dan and I kind of made a faux pas, but she came on board and we're like, oh, great, Taylor's here. We're just going to send her every email we've had from the past year about accreditation. No context, no organization. We're just going to send it all to her. So she kind of called us out and said, hey, you guys need to like talk to me about what's important. So she straightened us out, I'm happy to say. We've started, she did staff training for all the staff yesterday. I think her first day was the day before our first staff meeting that you went to. There were a lot of questions about, is this going to be, you know, how's this going? I think some of them were just, how is this going to impact my job and what I do daily? So she did a training yesterday asked for volunteers from staff to help with the process of the first part's initial registration, second part's actually a readiness assessment. So she asked for volunteers for that. So far, I don't know that you've gotten any, but I think you're going to send out an email soliciting more assistance.
Yeah, I sent that out about an hour or two ago.
Okay. But good questions at the end. I think we met for our first domain assessment, and it was just the managers. Taylor wanted to see how like the managers would do answering these questions. I'm pretty sure we failed miserably, but I'm joking. We got through about half of it in about the full amount of time that she thought it would be. So there's going to be a little bit of a learning curve, and really whether you get the answer yes or no to you meet a requirement is not whether you're actually doing it, it's whether you can have documentation to show that you're doing it.
Yeah.
And it's kind of what I had said to staff before, is we do a lot of great things. We do them all day, every day. We look at our processes and we improve them, but if you don't document that you're doing that, you didn't do it. And so,
There we go.
and when it comes to accountability and transparency, if you didn't document how you did something, it gets really hard to replicate. When if Dan came up with all these good ideas and Dan leaves, then no one knows how he did that. And so this is going to be a tough process, but we are going to be so much better when we are done.
Can we go retro credit, or is it going forward from this point on?
It's going forward.
So you don't get past credit if you can prove it, I guess.
If we can prove it, it counts.
So we can't get retro credit. Okay.
Yes. It's just a lot of the things. I mean, there's some stuff we can prove. There was stuff today, and I'm trying to think. It was like our investment in. So the one we did today was staff development. And one of the things was, can you show that you are promoting the field of public health and helping people along a public health career? And we do all kinds of stuff. I mean, we've been very active for years with students, with interns. We have multiple internship agreements. We have all kinds of things that we can show that we do that. So that's one of those things we can check off and say, we're good. Not every health department actually does that, but it takes time. But if you remember Rebecca Richardson, who had done the salary study presentation, she was one of our interns. It's a great interview process, having someone come in and work 600 hours for you for free, and you get to see what their approach is going to be and their enthusiasm. And typically we almost always get lucky. You know, I think very rarely have we encountered students that were an issue. It happens, but you know, we've hired a lot of our students. So that's just one example of, yes, we get accounted and we won't have to do anything else.
So in the medical world, we have to do like procedure logs or whatever. You have to have so many to get credit for it. Do you get credit for the process, or do you have to have several examples of the process to get the credit?
So it depends on the specific domain and the specific standards, but they tell you pretty specifically what you need to have. And then you need to have documentation of those examples. And then in relation to your previous question, I think that a lot of the examples can be used from previous years, but I don't know if you were asking if we could get accredited retrospective.
No, not credit retrospect. I'm talking about the examples that we need
Yeah.
to get accredited. We can go back and we can have evidence to prove that we did it.
Right.
Within a certain time frame.
Yeah.
And that varies.
Oh, that
according
varies.
to Taylor. So some of that stuff, like we can go back 5 years. If we've done it in the past 5, it counts. Some of it's like in the past year, and it just depends on the domain and the specific measure under, and I'm getting the terminology all wrong, but is it a measure
Right. Yeah.
under the domain?
Mhm.
Is this
She's
what we're
trying
gonna
to,
be learning next Wednesday?
what's
Is this
that?
what we're gonna be
Learning
learning?
next Wednesday?
No,
Oh,
Oh, okay.
so that will be state training, and so they'll touch about accreditation, but probably they're going to be talking more about just what public health. So Dr. Kingsley and I have discussed this before. Not every board of health is made up of medical professionals and a veterinarian, not who's been on the board of health for 300 years. I'm sorry, a long time.
25 meetings here.
So not every board of health that has that makeup. So some of it is just going to be what is public health. Some of it's going to be the role of the board and those types of things.
Okay, okay.
And that's next Wednesday at 6.
Yes.
You coming?
We all are.
Okay, good, all right.
Are you guys just need to be posted since we're all gonna come?
Yes.
And that's right here.
Yes.
Now, is that person coming or we have to do it like
No, they'll be here.
physically? Okay, cool. All right.
Isn't there a national meeting at some time throughout the year for like health departments and boards?
So there's a National Association of Local Boards of Health, and that's the acronym is NALBO. There used to be a MALBO, which is the Missouri Association of Local Boards of Health.
Okay.
That is pretty much defunct. And actually on my call with the state, actually it was with MOSIPI, which is the Missouri Centers for Public Health Excellence. They were talking about ways that they could educate the board and get them more involved. And I said, in my opinion, if we could infuse some effort into getting Malvo back up and running, I know I actually have board members that would most likely be interested in an association like that and the opportunity to compare notes and work with others and just see what other folks are doing. They said they take that under advisement, but we can certainly get the board information about NALBO, and you can at least get their publications. Is that of interest?
And that gives us credit towards the accreditation stuff that we're trying to accomplish anyway, right? If we start.
Not really,
Oh, okay.
that doesn't, but it does make you more aware of local public health agency concerns, issues, approaches, innovative solutions from across the country.
Well, I'm very interested in anything where I can find benchmarking details so we can measure what is objectively measurable to becoming the best health department in the state.
So that is what accreditation will do.
Right.
So all of those types of things you mentioned are absolutely in the accreditation
So
process.
as we go, as we go through that, I was just saying that there may be some things that further educational opportunities that I'd be interested in hearing about.
So I asked, or is it a good idea or bad idea to invite the resident?
Actually, I think we did invite him, correct?
Yes,
Exactly, yeah.
Have we ever heard no confirmation, no?
he said he'd be here,
Okay.
but I'll send him a reminder tomorrow.
Supposedly he's gonna be there. Okay, I will just adding, going to the Clay County open house thing, I think was really eye-opening, hearing, talking to those other groups, how they do stuff, so. Meeting with other groups, other board members across the country or locally or whatever, I think it's only gonna help, so. Okay,
I think the next thing is, so we are not very far into the 24 budget. So I don't really get to take much credit for anything, although we are 8.3% through the year in January of 24, and we brought in 55% of the projected revenue. So I'll take total credit for that. And I think you all know that's just how the
Yeah.
tax fund happens.
Right.
We'll get the other some through the year, but it's going to be mainly in December. And then at the end of January, as far as expenses, we should also be at about 8.3%. And again, this fluctuates greatly because We'll pay insurance once a year. We have different bills that can be significant that we pay once a year, but we were about 6.3% of our expenditures. Our money market balance, we are about $57,000 more than we were a year ago. And that's pretty good considering we actually utilized some of that money, but it's not really reserved, and we're going to talk about that here in a minute. But some of that unaccounted operating fund for the building and different things that normally we wouldn't have had as many expenses as we did last year. So we're looking pretty good. And that's my report. Dan?
So you may remember Stacy Bettinghoff left employment with us after a long career, and she has now been replaced with health education supervisor Tricia Rothweiler. Tricia is also with us, in fact, longer than Stacy. She's been with us for 20 years and is transitioning into that role. Previously, Tricia was our social worker in the family health care clinic, so we are happy to have been able to find her a landing spot. As we transition, she'll continue to work at least part-time in that social worker role, but is tasked with learning her new role as well. And Rebecca Richardson, who Andrew mentioned earlier, is one of our health educators. She'll be leaving on maternity leave in about 2 months. So Tricia will be somewhat alone in her new role, but she is quite capable, and we're very happy to have her on board.
So are we planning on getting another social worker, or she can still cover what needs to be covered?
I think between her and some other nursing staff that Dustin has found willing to help out, between those folks, that we've been able to meet our obligations as far as the social work piece. And I think there's actually 2 staff members that have contributed to kind of fill in.
Pretty much one particular, but we will be utilizing, and we do have some other plans. We're kind of in the process of discussing, trying to help account for that.
So, yeah, our intent is not to hire anyone.
Okay.
One of the reasons Tricia moved was she, like Dan said, she's worked here for over 20 years, and she really wanted to stay an employee of the health department. And, her experience is actually a great fit for the position, but that position just happened to open. There was no planning for that. And so she is committed to try to, and we actually get half of her funding through the Northland Healthcare Access. So she is actually going to work half time over there so we can still bring in that money. But so far, what we have decided is we are at least going to try to fill in rather than hire someone that we would end up in that same situation potentially.
Tricia will also be supervising, in addition to Rebecca Richardson, she'll be supervising Tia Biggis, who's our family support worker. Her report looks like that in your board packet, but she's the individual that's been responsible for visiting new parents in their homes, the crib visits, the child safety seats. She has led that, the car seats. She's led the efforts with the driver education contract that we have with the the Highway Department of Transportation. So that all of those roles will now be in the health education department.
So we call Tia home-based visiting, but in most jurisdictions and health departments, they're called community health workers. So they're basically linking our citizens to resources that exist, sometimes filling in gaps, but they're actually really hands-on. If you look at Tia's expense report when it comes through, she has a lot of miles because she sees a lot of people, and she's actually hardly ever here.
Right.
Which is her job, is to be out consulting with
How do the
folks.
families get referred to her? What happens? What actually has to happen?
That's a good question. I am not
So
totally familiar.
I know for us, for a few different ways, like for family healthcare clinic as well as public health clinic, we do like when we do pregnancy tests or things like that, we try to connect them with, we'll also refer them to her, just for, cause like they do like, you know, the Safe Trips program, the diaper, Happy Babies, Happy Bottoms program. So we do, so yeah, we do work with her a lot for that. And like she has a folder in her office where we will put those referrals in there for her. And when she comes in, she tries to get in about once a week and we'll review those and get supplies and.
So it's not like Child Protective Services.
No.
It's not like.
And actually, what I was going to say is the majority of her referrals are from WIC and the clinic,
That's what I was gonna
but
say.
WIC does a lot of those referrals to her. Because they know what she's providing and they're seeing them and they're like, you know, they'll ask, do you have a child car, you know, do you have a car seat? No, oh, we know just who to connect you with for a free car seat. And almost just as important, we know how to connect you with, how to teach you how to get that thing installed properly.
And she's, you know, very good with new parents. She's a parent of, I believe, 4 herself. So she's an experienced parent, very calm and a very pleasant person. So I think she's kind of beloved.
And Rebecca Richardson, will she come back after,
She will. She'll be off for 12 weeks.
Okay,
So she'll be
after
back.
maternity leave? So
Right.
then she'll be there to help in that
Right.
area. Okay.
Yeah, it's going to be a tight struggle just because we have new folks in positions or relatively new folks in those positions. But I think you have all seen the caliber of employee Rebecca is, at least in her presentation.
She'll be
And
fine.
as far as I know, I don't think she's pulling the wool over anyone's eyes. And so she's been working with Trisha, I mean, just every day to try to, you know, making lists and putting stuff on the calendars and
Okay.
just planning that whole, she'll have new planning to do during those 12 weeks, but she's planning for her old life too. So it's been really good. I think they've gotten along quite well.
Yeah, and they are very, well, at least Tricia is very familiar with many of the partnerships that Stacy built over the years, and will continue with those partnerships with our school districts and North Main Coalition and other partners. We'll continue with the back to school fair and the senior fairs and those great events, those great community events we've been a part of, as well as the new Harvesters food distributions, which we had our second one last week.
Was that based out of the garage or how do we actually do it? Yeah, that garage is gonna have multiple uses.
It is, yeah.
And we met today with Don Padre and Trisha to just talk about doing some things for that garage. You know, the idea, of course, we're doing good for the community, and I think I've said this, it is really a great exercise for us to work on any distributions that we might do. And I know Dustin and Cindy and Dan, they're all having staff rotate through, helping out there. So they think, oh, we're just giving out food and it's a feel-good thing. Well, yes, you're doing that, but what we're also doing is we're preparing for any event where we might have to distribute antibiotics or anything, might be shots, who knows what it might be. But if everyone knows the traffic patterns, if everyone knows what their job is supposed to be, we are going to be much better prepared. And it's kind of like learning to use a certain computer program. If you only use that certain computer program once every 18 months, you almost have to relearn it every time. If you're doing that every month, balancing your checkbook or whatever it is, you probably remember how to do it. And we actually had a 2-hour meeting today just about setting stuff up, like we're going to mount stop signs in each of the bays of the garage. But yes, it's going to be great for the harvesters, but it's also going to be exactly what we need for when we do any other kind of distribution. And I think we are going to put permanent labels on each of the garage doors up high that are 1, 2, and 3. because go to that garage door that's
Over
open
there.
is a little hard when there's 50 people behind you and it's loud and people are talking. It's much easier to say, go to bay one. And we had some magnetic ones. And we're like, why don't we just set that up? So I think that whole process is going to be great. Learning to deal with some of the traffic is already an experience, but I'd say the drive-through so far have been very successful. They're just going to get better. Sorry, Dan.
No, that's good. Another change to our org chart is that Taylor will be supervising the epidemiologist and the public health disease investigator. Taylor actually has some experience doing that herself, so it really makes more sense than the deputy director supervising those folks, because I don't have that experience. So anyway, that's a change that I think will benefit the department in the long run.
So you're gonna be going on site visits too then, or you're just overseeing?
So it's more
Just oversight?
investigations and things, not the environmental health.
Yeah,
people that-
Yeah, and I think, so a couple things with that is Taylor did do that job at the Cass County Health Department. So I think I've told most of you, I actually knew Taylor before and I was her boss before. So she's a glutton for punishment. They come back.
And everybody's got problems.
But she, with accreditation, there's a heavy reliance on the community health assessment and the community health improvement plan. And that is one thing that Erin, who she'll be supervising, has contributed a ton to and knows the numbers and does all the number crunching for that. So it just makes sense for them to work really closely together and to give Taylor that ability to prioritize some of the projects that Erin is working on. So we are staying moving on the accreditation front. And then with the public health investigator, it just makes sense because Taylor does have that experience. So I think Dan was a little hesitant at first just because of maybe the change, and he's managed that so well and through some very difficult circumstances for a long time. But then he walked in one day, he's like, that's actually a great idea. So I think that'll be great.
Yeah, and it's, I'm, as you all can tell, I'm kind of old, so I'm not gonna be here a whole lot longer. So I think just, I'm making some of these changes now makes some sense.
You meant you're going to retire, right?
Yes, exactly. I'm not being deceased or anything, but at least I hope not. But no, I do, in a year and a half or so, we'll be retiring. So, like I said, anyway, even if I weren't retiring, it just makes sense when it comes to span of control. And I think it's just better for the department. And then, let's see, so this report that you're used to, the Liberal Disease report, will be actually part of Taylor's report moving forward. This report.
Dan was very nice to Taylor and said, since you've been here for like 2 weeks, I won't make you do the report and explain everything. He's going to give her a whole 6 weeks.
Additional staffing changes, we've hired Frank Atkins as our part-time facility maintenance technician. And he's been, let's see, when did we start? About a month ago. He works 20 hours a week, and he'll be the person that, changes our furnace filters, does, hangs things on the wall, paints, whatever jobs need to be done, he'll do them. Put like door stops on the doors and things like that. Just whatever we need done. He's been really good at it so far. So happy to have him on board.
And there's things like, if you've noticed, we have a goose poop problem. They come with the geese problem. And so like every morning when he's working, he's blowing off the sidewalks to get the goose poop off. He is going to have a schedule of, they do spot cleaning in our custodial or spot vacuuming for our custodial contract, but that doesn't mean every piece of carpet gets really vacuumed well. So he'll do every carpet at least once a quarter and then do any spot removal. You know, having spots in your carpet stay there, it kind of eats away at the fibers and you get holes and stuff. So just trying to do what we can to make sure our very nice building stays that way as long as possible.
We still have the spares, right?
We do.
The little squares, yeah.
And kind of what Dan said, like he knows how to hold those off, put new adhesive down. I mean, that's not that hard, but it's something that if someone's not watching for it, sometimes those things can go for a long time.
He'll also do some minor electrical and is a great welder, so, and a pretty innovative guy, so, we're happy to have him on board.
Dan's anxious for him not getting roped into my electrical project, so.
That's good. We also are hosting a high school intern with the Park Hill High School's professional studies program. She's an aspiring medical professional, so she'll be with us for 6 hours a week through May or early May. And she's been very helpful, actually, working on some projects with Rebecca and with our environmental health team. And then in environmental health, we have all of our food establishments have paid for the permits this year, so all those permits have been issued with very little resistance, so that's good. Does the board have any questions I can answer?
Just the diagram that had the measles thing on it, is that something we're gonna talk about, or is that? I just want to know if we have any updates on the measles outbreak that we had to worry about.
Just look like two measles contacts.
Two measles contacts, that was the end of it?
You know what?
So I think from what Aaron said, they were both a little bit elderly and they had both had measles as a child, so they were not.
So they were
did not
exposed.
need to quarantine.
But no symptoms.
Yeah.
Yeah.
So yeah, they were not quarantined.
So as much to do about nothing.
At least
So far.
Yeah.
so far.
Watch your February report, maybe.
Yeah, I mean, I think the interesting part about that is just, we were called, you know, I think I told you, we were getting the call like on Saturday evening at like 7 or 8, I think, was about when that came through. And so just getting a hold of those people, and I think I mentioned to the board, Aaron had, by the time I got the message to Aaron to call them, she had already done it and reported back. So better than mine and Dan's communication, I think, so.
Okay.
Yeah, I think we've recently had a Yersinia case, not the Backward Estes, but I believe that it's still Constance's case in Black County, so maybe hearing more about those as we learn more.
Everybody in Missouri has that.
And you just hang out in a barn somewhere.
Sure enough.
I have a question, and maybe I should know this, and screenager screening. It's on this, I just didn't know what that was. Attended Park Hill Screenager Planning Steering Committee.
Maybe get back to you on that.
Green anger.
Screen anger,
That's a big difference.
okay. Yeah,
I don't even know what that is.
We'll get that back. Get back to you.
well, here it's spelled no, it's not. Yeah, it's spelled differently here than here. I didn't know what it was. Thank you.
Yeah, but it's screen injury.
One screen anger and then one screen anger. Yeah.
I'll send the board an email,
Okay,
describe what that is.
For the clinic manager report, speaking of measles, let's kind of tie that in real quick. Nothing really concerning for us, hopefully right now. But every couple of years or so, we do like an IQIP visit. So that's for immunization quality improvement for the providers. So we had ours last month and they came by and were very impressed with a lot of our numbers and everything. They like to look at 2-year-olds as well as adolescents between 13 and 14 years of age to see where they're at on up-to-date immunizations. And measles was the example I was going to use for you. So for the county average of those who've had their first measles shots for up to 2 years of age is sitting at about 34%. The jurisdictions up in Northwest region, we're sitting at about 49%. For us ourselves, we're getting our patients about 63% are up to date on that. So that's pretty much across the board for a lot of our different vaccines we provide here. So they were very impressed with us. They love what we're doing. They gave us a few recommendations of things that how to improve better because right now we're doing a lot of the school clinics. So all those patients we see there aren't actually our patients. They just don't come here routinely. We just go in, give them a shot for school, but they still get into our system and counted as that. So it makes our numbers look a little bit different. So if anything, it brings us down instead of bringing our numbers up for having better returns for follow-up immunizations. But that went very well. I did go with Andrew, presented at an HCA meeting regarding moving to an RFP. We're still continuing with our naloxone distribution, gave out about 16 boxes last month. We have re-enrolled for the Vaccines for Children program that has been approved. The 317 program, which is like state funded for adult vaccines, is kind of changing right now. It's moving more towards a vaccines for adult that's actually in legislation. They're trying to get federal funding for it to be similar to the Vaccines for Children program, that any adult immunization will be available for those who are underinsured and uninsured. So that'll open up a lot of vaccines that aren't regularly available right now, like Shingrix is a big one. And then RSV, once more supply of that, it ends up becoming available. Currently, we're sitting about 6 LTBI cases. COVID vaccine requests and flu requests are kind of down, as well as testing. We are still giving out a lot of like free take-home tests for COVID, and those are going through pretty quickly. We partnered with Park Hill School District and their professional studies program, which we have one of the interns here. We go do 2-step testing for their students at about 56 tests total. And serving on various different committee meetings. We have our students, as we discussed earlier, coming here for from Rockhurst and Park University. Currently working on hiring a vaccine program manager still. I was actually speaking to a colleague today, and they've had similar issues trying to hire any nursing staff. They said pretty much since post-COVID, it's been very difficult to try to compete with like hospitals and other clinics who are offering like onboarding bonuses and things like that. So does anyone else have any questions about anything?
Yeah, so the Park Hill professionals TB testing, do you guys actually go to the schools and do the testing and checking?
We usually go, so they meet up at St. Luke's Spot in Barry. They have a small little clinic office space. They work out of there and like they'll do their introductory teaching there. So we'll just go there, do the offsite there, and usually it's in the morning and then one group of students in the afternoon, and then follow up in about a week and a half and repeat the process.
And school nurses, I used to read those too. Yeah, if they didn't make it back.
Yeah, they're nurses. They're a professor and nurse, so she reads the test for them.
So both of my kids have gone through it. The older one had to actually come to the health department to get it done. The second one, I think, actually did it at school.
I think one year we had to do it in the clinic because they had lost one of their clinic sites, and we're having to try to, because they used to actually come to us and like have the Hawk that was downstairs at Parkville, and sometimes we'd do like their classes there.
It'd just be easier to catch them all at once. You just come on Monday, do it, come back on Wednesday to test it, you're done. Yeah.
Okay. Moving on to Susan.
Okay. You all have a memo. It's an additional one that we put out that Andrew and Dan worked on. We all met on Tuesday, the 13th, here at 10:30 a.m. and Dr. Kingsley was there via Zoom as well. And we had talked about pretty much the whole meeting was about our reserve funds and how we were going to do that. And we were into 4 groups the month before, and we went down to 2 accounts that we would have as reserves. And we talked about naming them operating reserve and building reserve. Our operating reserve might be what you would call your emergency, but we went ahead and put it as operating, and the definitions are on the back on table 1. And that would be funds set aside for use in future periods. There may be, something, different things come up that would be used for. And then your building reserve would be set aside for planned capital projects and replacement of building components. Do you want to add something?
I think that's a pretty good summary. I think, the month before and actually discussions prior to that, we were thinking a bunch of different reserves, but really when we boiled down what we needed money for was if we had some sort of reason that we would be getting cut off from our normal funding stream, or we would need to increase services somehow, we would want to have extra money. It's in the description a little bit, but one of the things I asked Dan to do was, find out what is the standard, what's the best practice. And so he looked at the Government Finance Officers Association, and they basically said it should be no less than 2 months. 2 months seemed a little light to the committee. So we decided, at least a quarter in reserve would give you some time to pivot and maybe do some things with your structure if we had to. I hope it never comes to that, but it wouldn't be,
What is our operating expenses for just 1 month? I guess that's the real question.
Yes.
12 to 4,066,000-ish.
Right? And so if you want 3 months reserve, you would be that times 3, essentially is kind of your goal. Is that what we're looking into?
yeah, it's the 1,084,000
Yeah.
is for 3 months.
3 months, right? And then to touch that money,
You have to use board action.
board action to decide. Now, do we have guidelines of kind of what would be examples we'd actually use the money for? Did we come in, because I think I brought that up, like, what would be something that, okay, yeah, we need to dip into this money for this or something like that? What would be some examples, I guess?
If for some reason we had a budget set and the tax revenues were going to fall real short, we might ask, bring that information to the board, and the board might decide to dip into that money.
So that would be at the end of the fiscal year. We're short of money because X, Y, and Z. This helps pay that whatever month or 2 months bills. That's kind of
Possibly, but if that happens, we're also probably going to need to look real hard at the budget and decide if we're going to have to make cuts, because you can't operate on reserves for perpetuity.
Right.
If it's something that's a short-term pickup, then this would definitely handle it.
Right.
But it might just handle the time we need to pivot and look at how we are, allocating resources.
The way I look at it, I just don't want it to be like a slush fund that we can always just do. We'll just dip into that. We got that covered, no problem. Yeah.
As far as I'm concerned, it is like
It
we have
basically-
COVID or
That's what I'm saying.
something.
Like
Something like in a
big
reason why we
event.
would do it.
A big
Right.
event, yes.
Yeah, a
I think
massive,
it's-
something horrible happened.
Yes.
This is
More
Right.
operate.
Pandemics, disasters,
Yeah,
Yeah.
major loss of funding, which is, you guys already have that here.
And at least in my mind, Dr. Chape, that's why I wanted the board action was, it's not just up to Andrew to like,
Yeah.
I
what's
don't want
Andrew's
that.
big event?
Right.
I can give you a good example. If, for example, there was another pandemic with a new novel virus and somebody came out with testing equipment for it that was substantial, and to do the testing, you're gonna have to buy a lot of test
Right.
equipment, and not just the equipment, but also test materials. Let's say you're looking at $30,000-$40,000. You've got the money there for emergency stuff, and you're not pulling off your operating reserves.
Correct.
Plus, if you have to bring in a few emergency employees to begin doing the testing process, that would be an
Again, that would be a
example that
board
I would be
decision.
enthusiastic
Yes,
to
yeah.
support it.
Right.
And I think the good part about that is, like Dr. Chaffee said, you need to have that money. But most likely, if this is a national or worldwide event, we'll be able to submit to get
To get some money
probably
too.
a lot of that paid back to us for reimbursement. But
You gotta have
up
money up
front,
front.
you gotta have the
You
money.
gotta have it up front.
Yeah,
And-
because you may have to wait 6 months from the. Right.
Yeah, having that testing equipment 6 months from now,
Mhm.
not
That's
gonna
hard.
do, I mean, we've been through that.
Yeah.
You know, we know how
I'll
that
give you
works.
another example we've talked about tonight, measles. We know people lose their immunity to measles even if they've had.
Mhm.
We get a measles outbreak, it's not gonna be happy. And so if we suddenly have to fund specialized measles testing, surveillance, implementation, more trackers for a mini outbreak to try to, deal with it, that's a real possibility.
Right,
I mean, it's happened all around the country.
yes. I don't like you bringing it up, but you're absolutely
Yes.
right.
No,
But
I think we wanted examples of what we've used things for, and I wouldn't call that a pandemic, I would call it a local epidemics that need immediate intervention.
And we will, internally reallocate people that we can reallocate to that. But that's not going to necessarily meet the need of what we need to do.
So let's say there's a massive flood again, park goes underwater. Would we dip into that money for that situation for services at that point? Is that something that we would need money for?
It might be something that, we want to be there to help give tetanus shots and provide, different kinds of support. Hopefully we'll be able to do that through our normal budget. But it might come to that. I mean, I think really before I bring it to you, I am going to have tried everything I can to move pieces around and not to have to touch that money. Because that money is, I think, for those things that we know we can't, like this big measles outbreak or whatever it is, something that is just beyond our normal scope that we need to react to.
I just don't want it being spent on like, we got a couple potholes here and they need to get fixed.
Oh,
We want
no,
to put
no.
new lights.
No.
I don't want it touched for that. This is for an emergency situation.
Yes.
Okay.
And then our building reserve, we talked about that Andrew, there may be some things that we would give him before we would do board approval for that, up to $10,000 for some emergency situations. And would that be the parking lot?
If we had a
Might
big
be.
sinkhole and I needed that fixed today, basically what we talked about would be, I could plan on using those funds up to $10,000 without board approval, and then kind of like the thermostats, ask for some forgiveness that, I'm not going to take much of a risk doing something that I think the board is not going to approve of, because I think most of us were reasonable and cautious, and we're going to, we can't have a sinkhole where a Pinto could, I don't know if anyone drives a Pinto, but
Somebody
that?
probably does.
Used to.
Yeah,
but no one's gonna drive their car into their Tesla.
Just don't back up into it.
Not
You'll
recently,
float.
thank goodness.
Does finance committee think that we can flesh out maybe some broader guidelines that are inclusive with examples on the building funds? I think are straightforward, building reserves, and the way you guys have, really put together call it a depreciation sheet, but it's a life expectancy. That's very proactive, and making sure that's in the budget is really a good thing to do. But the operating reserves, maybe, I don't know, come up with some language that we can provide guidance to future boards that weren't involved in this. You can use a term like prospective capital or potentially reimbursable urgent needs. Don't necessarily need to see emergent, but urgent needs, for example, infectious disease outbreaks, emergent, urgent/emergent testing and staffing necessary for unforeseen issues.
Okay, sure.
It's sort of saying it's the seed money for ideally reimbursable items, because anything we do typically, we should be able to submit for funding. But this, some language saying this is prospective for fast actions, capital for quick action items.
Yeah, well, Cindy, hopefully you heard this, but can you put that on our agenda for next month's finance committee meeting? And we can discuss it then and come up with.
Just so that 8-10 years down the road, if there's one of these events that comes up, there's some guidance and some thinking within this, and the board at that time can amend and change it all however they deem the needs are at that time, but at least this gives some guidance what we were thinking.
And the other thing too is the recommended amount's gonna change as the years go by, obviously inflation
Right.
and whatever, so that'll have to change with the time.
But that'll go with the committee and, yeah.
Well, I
So
think
just
that's why
reassess
we,
It's a 3-month operating reserve, so whether you say it's 25% of the annual budget or 3 months.
Approved, that's the same,
Yeah.
yeah.
so that's why I actually worded it that way.
That's a really
Was,
good way to
you
do it.
know, our budget right now is around 4 million. In 5 years, it might be close to 5 or 4.5, whatever. That's just going to be a moving target. And then
Yeah.
same with the major building components. Nothing ever goes down in price. It only goes up. So, you know, I think.
So how did you guys choose? I probably was not listening when you guys, the 2,200,000 for the building reserve. How did you guys come to that number?
So if you look at table 2, that is all
On
the major,
Back page,
Page, okay.
that's all the major building components. And basically what an estimated replacement cost and how long we think those should be. And that's actually just the number for the first cycle of replacement.
Okay, and we expect to use this money, right? Because stuff is gonna break down over time.
Yes.
Yeah. Yeah.
We're expecting to use it not all at once, which is good because we don't have the $2.2 million all at once.
Right.
What we are hopeful is, like, some of the first things are 3 years. We know we'll have $10,000 to do the seal coat and the striping, and it may last a little longer, it may last a little less, but we'll bring that to the board and say this, we'd like to pay for this out of the building reserve. And this is one of those allocated expenses.
So best case scenario, they're fully funded now. Both of these reserves are. What happens to going forward, all that extra money? Where is that gonna get funded into?
You know, I don't know that we'll get to that point anytime in the near future. And we'll also be, hopefully, I think Dr. Chaffee said it, being the best health department in the state, we are going to have really good assessment of what our community needs are and allocating our resources to meet those needs. So, you know, it may be that we're expanding programs or whatever that we haven't been able to afford in the past because we were trying to make sure our reserves were at the proper level. Or it may be, you know, like we have discussed, you know, looking at the tax levy, if we actually are meeting all the funding needs, well, you don't just hang on to that money, you would take less so you can still perform the need. So it's gonna take a really long time.
What's the time frame you think before we build these up?
20 years.
Yeah, we did talk about, typically in November, December, we reach the low point in our balance, of cash on hand, and it's right now about, most recently in November, December is about $825,000. So we talked about moving that down, that kind of minimum down to 500,000 and then taking that extra 324,000, using that as seed money for the two reserve accounts.
So that's how we would fund it every year. So if you figure it's $300,000 every year that we're putting into those accounts, that may seem like we get to those amounts pretty quickly, but we're going to start spending from those accounts too.
Right.
Not so much the
Operate.
operating reserve,
Right.
but the building reserve, especially once we get 10 years down the road, it's going to be kind of a in and out type.
That might be best case scenario. Most stuff breaks down now, it seems like 5-6 years, it seems like, but hopefully it's not
Always the ray of sun.
10 years.
Is there a recommendation on the amount per year to be placed into the budget to be allocated into the reserve funds?
We did this year, we budgeted 51,261 in
In
addition.
addition to the 300,000.
So,
So basically, oh, go ahead, Dan.
well, I was gonna say what we've typically done is, calculate or estimate our expenses and then our income and whenever there's an excess revenue, I should say. That excess revenue is what we put into that reserve line. This fiscal year, or this calendar year fiscal year, it's 51,261.
So overall, it'll mean about 370,000 that will go into these two accounts this year.
370 each or 370 split?
Split.
Yeah, so 100 and whatever. Okay.
185.
So these will be actual physical accounts, not just paper on. I mean, we're not talking about anything we haven't been doing already, to me, unless we actually put it somewhere.
So I think you're right, Dr. Jackson. We've had, we're not creating money. It's not new money. I think really the difference is, and what we talked about in the committee, is not actually having different physical accounts, but really redoing the accounting so that we know, like when you see the report that talks about the money market balance, these reserve amounts are not in that. These are to the side. These are not included. These are, like we said, not touchable for us to spend. We can't decide to spend it on whatever, although physically it's in the same account.
Yeah.
It's on the ledger sheet. It is totally separate.
And I think Michelle was going to, maybe for next month,
She's been working on
she's
that.
working on a system that when we get our reports, we'll see those reserve accounts. Even though they're not separate accounts, so it's more of a bookkeeping or a.
Right.
And we could do separate accounts. We've discussed it both ways. It's just a little harder to make the deposits and accounting.
Does the building reserve account adjust for inflation and the increase with inflation? Because annualized inflation is averaged about 4% per year. So in 10 years, if that's compounded 10 years from now, if we get this fully funded in 10 years, it may be only 50% of it. So,
And that's gonna change.
Of what's actually.
so that's why
So we'll clarify that too.
how that should be funded and what its minimum should be to fund it, so that perhaps the funding guidance for the board or finance committee would be to fund each of these accounts at X% of the annual budget until they're fully funded. And then we've got adjustments for the building reserve fund in the form of inflationary adjustments. I really think that if we want to do this as detailed as possible, we consider putting some of those things in place now for budgeting guidance, adjusting to the inflationary issues, and that if there's some guidance to when making the budget each year. For example, we're going to take 10% of the total budget and to begin to fund these at 5%, or some number that we want to fund these until they're fully funded. Ideally, once they're fully funded, they're going to be okay as long as we have inflationary adjustments. Now, the operating reserve that adjusts based on the annual operating budget.
See, I was gonna say that if you good to what Kent was saying. So if we actually made these actual real funds, real accounts at a bank, money market account, whatever, that's getting, that would hopefully circumvent kind of what you're talking about.
Right. I think similar to your and my experience on another board, I think there should be a maximum and a minimum setting for those accounts. Right now, we're saying minimum of 3 months operating expenses, and the recommended for the building reserve is cost of major equipment. the cost basis of that, the current insulation costs? Or how, when the recommendation was made for that, are we supposed to take into account the future costs of them?
I think what we were thinking is we would just take whatever the inflation index each year is and move it up. And do that annually,
So, but
because that's what we built into the top, to the
Yeah,
operating.
I think that there has to be a minimum, maximum, and I kind of got myself on a tangent, but 3 months reserves, let's say, and then the operating budget, but a maximum of 4 months reserves, for example, on the operating reserve. So if that operating reserve is getting 3.5% interest and it happens to be a separate account or in an interest-bearing account, we need to know what we're doing with that. And not let it grow too big and just become money sitting there.
Yes.
But it needs to be cropped
We did
out,
try
because
to
if we
talk
get
about
them
that.
fully funded, and then we have additional money at the end of the year, we just don't add it to it. I think we should have a maximum and a minimum.
Okay,
and then that
we
money
kind
can
of
be
talked
diverted to
about
something.
that.
I'm throwing it out as an idea.
Yeah.
Just-
We did talk about it and then we,
Yeah, I'm a little disappointed in you, Dr. Chape, because it makes Dan right.
yeah.
And so,
But is that an option to actually get two separate accounts that actually their own little money market accounts that hopefully get the highest interest rate? Because we shouldn't be touching this money for quite a long time. Shouldn't be.
so our interest rate's pretty competitive in what we have it in.
Right.
So I don't know that we'll get any better.
Okay.
And,
And
you know, staff recommendation was
to
to
leave it, yeah,
To leave it in there.
leave it.
yeah, it'll be separate on the report,
Sure.
but that money was there, that was easier for her.
And that's in the money market it's making, was it 4.75 or whatever that is?
Right.
That's what it's making right now. Yeah. Okay.
Michelle's all funds report that's in the board packet,
Did
will
she
look
kind
a
of,
little different next month.
right,
It'll include the
she's
two
working on it.
reserve accounts.
I have 2 more questions. What does our accountant say about this?
We haven't asked the accountant.
Because that's the one who probably should really help us decide how it should be. To me, if it was my money, I'd want to have it as a separate savings account. Because if it's all blended together,
I would
nobody
parse
can
it
ever
out.
know.
I agree. I agree with that. Yeah.
The other thing is, if we have extra money at the end of the year, how do we prioritize whether we put it towards the building or do we put it towards this?
Well, hopefully you
We
just split
split
it in
it.
half. It just goes to whatever.
I think
Well,
he
even
means
goes to
paying
paying off
the
the bill.
lease
Because
purchase.
everybody's
Oh, yeah,
talking about
right.
wanting to get that done.
Yeah, I see what you're saying. Yeah, I agree.
We're saying all this money back that we could pay towards the building.
I agree with that 100%.
That's-
Okay.
I do believe that having a way to build these reserve accounts is reasonable while aggressively paying down.
Right, I think it should be set up as some sort of a monthly item that you put so much away. It'll grow. And it's just gotta be where it's not,
So we put together, or we decided, you know, and we have finished the re-amortization. And we are going to have the building paid off if we pay the current amount, I believe, in like 11 years. So we have a pretty aggressive payment plan. And I think the way we were trying to pay for or put money into these reserve accounts was basically look at the monies that we had kind of in excess in November and December above the 500,000. And that would allow us to still have plenty of operating cushion, still be able to pursue the lease purchase aggressively and not hurt our program. And, you know, 300,000 a year, which is, when we look, that's about how much we would be putting in. So this year, a little more. That seemed like a pretty good effort to fund those accounts.
Because I agree with what you're saying though. So it would be nice if instead of putting the 300,000 to this, that we just keep pouring into the building. But then let's say all of a sudden park goes underwater and we have to dip in. We need to have something available.
where we managed it. I think you just gotta remember too, that this is different than like when I was in practice. I didn't get paid unless I worked. I didn't get paid till after I worked. In this business, you get paid before you do anything, you just got all year to spend it.
Right.
Basically, what comes down to. So we just need to, anyway, I know it's all good, but
I think that there does need to be guidance on how to build these funds while aggressively paying down the debt we have.
Sure.
all balance years.
And the thing is, in 10 years, it may be no emergencies, and then we're like, oh, that'd have been nice to put all that money straight to the building. I 100%
The
agree with
only
you.
other thing is, if you have it all saved up, you're not gonna use it, you just pay it off then. So
That's true.
It's all 6 months after. We're so lucky that the interest rate we got is so low. That we're really, it's almost like a free loan.
Sure.
The bank
In
is,
fact, our money market's a higher interest rate than our loan.
right, so the bank is, if you really think about it, the bank is not making anything really off of us.
So I guess my question to you, Dr. Chaffee, is you would like us to have a different plan than looking at the kind of excess each year to determine how much we are putting into reserves? Because that's stated in
I think
the,
I have two thoughts that I throw to the committee to consider. One is to have a line item in the budget planned to fund these two funds at some percentage of the total budget. But also a plan how to allocate excess resources at the end of the year. If it's an 80-20 to pay off the debt, 20%, 80% to pay off the debt, 20% to pay into these funds of excess, but have some funding plan with bracketed minimum and maximum amounts in these accounts. They'll be funded with line items on an annual basis of X% of the total budget. And excess funds at the end of the year shall be allocated in some guidance on how we want to allocate those. It's guidance, not necessarily a policy. Does that make sense? Just ideas I'm throwing out, at least that gives structure to this. And if we have a massive emergency or massive building issue, we can deal with that, but at least we'll start to build those funds up. And in 10 years, right? We expand. Kidding, joke.
I was thinking about putting a swimming pool.
We did.
so I think, Susan, we have enough to work on. for
Yes.
next month.
Yes.
I think we're gonna go.
So like Dr. Chaffee was saying, in our other board that we're on, we actually had to go through all this stuff too, because you get all this money and it varies from year to year. And then you have to decide, well, what are we gonna do with this extra money here? And and so it's nice to have just like kind of a guideline. And like I said, it makes sense to us now, but 10 years from now, it's a whole different board. What are they gonna think? Would it be nice to have guidelines for them to kind of guide them to where they need to go? And they may completely do opposite of what we want to do.
Right.
But at least the
We can assess
guidelines are there.
situation at the time, but while we're getting there's at least we had put some guidance to the methodology of how and why we're trying to approach it this way.
We appreciate the
Well, I
comments.
think this is
Some input.
super
You guys are doing great
important.
work. This is great.
Well, I think this is super important for a number of reasons, for all the different avenues that we're going to put this money. But I think one of the things that I feel really strongly about is that it's not looked at as extra money. Because this is, paying off the building faster and being fiscally responsible. That's not an extra thing. That's what we should be doing. Having the money up front and not having to go get a loan if we have to replace all the RTUs or whatever, that's just being fiscally responsible and having those cash. But sometimes how we've done it in the past, just having that money out there, knowing that we have this much in excess of our operating budget, it almost looks like extra. While, like you said, Dr. Jackson, it wasn't extra, but I just think we need to make sure we have it allocated for certain things for a purpose, and how we build that reserve is intentional, like you were saying.
Well, the county had reported, or it was in the paper that they had $8 million reserve. It doesn't say if they have it in a separate account or if it's just all put together.
And we'll ask Kenny what if there's any advantage or disadvantage to doing either. I think I know his answer, but we'll see what he says.
I would think you'd probably get a higher interest rate if you have more money in the account, right? Whereas less money, you probably won't get what, it's probably not as competitive to get the better rate. I could be wrong. So I kind of see what you're saying, Susan. I agree having it, but it
Well,
doesn't
that
hurt
was,
to ask.
that was my thing, is I said, are we gonna have separate accounts? Cause whatever, but when Michelle talked, she says it's just, you know, with the interest rate was one thing she talked about, and then also on her, the way she has it developed, it's there and it's not used.
Right.
It's accounted for and it's kept separate, but it's all into one because then.
But I agree with
Yeah, I
Ken saying
know.
too.
I know,
From an accounting standpoint, it's nice to just have, this is this.
it's
this is
easier,
this.
yeah,
And if someone comes along and wants to audit us and say, well, why you got all this money and it's in this special fund for this.
yeah,
Yeah,
I know, I hear you.
I'm pretty sure what he's going to say, as long as we have what Dr. Chaffee said, which is the guidelines or policy,
Of how to
about
utilize it.
why they're like this, and we're accounting for them separately, it's fine, but we'll see. I mean, I think I went into the unique accounts. That was what I was pushing for. But then when Michelle said, you know, the more money you have, the higher interest you're going to get. So if you have that all in one account, you're going to really optimize what you're going to be able to get.
So I guess just ask, and just for curiosity's sake, what would they offer us? And if they say, well, you get the same interest rate no matter which way you do it,
I think
or whatever, we need,
most of the
it's,
time, it's just a matter of there's a minimum amount you have to get that interest rate. And if you have $12 million, you don't necessarily have to have it all in one account. You can have,
Yeah, we could even have separate accounts at separate banks to kind of spread our business.
You might,
Okay,
you really want staff to listen to this and hear you have said that?
Yeah.
Because it just becomes a real,
it's difficult.
it becomes a nightmare
Mhm.
dealing with you get to know one organization and doing the shuffling you need to do, and now you want them to deal with.
But it's
four
Like to
people.
spread the love.
but it doesn't hurt to ask.
Yeah.
I agree with what you're saying. So
You can
yeah,
make
let's
it competitive, you know, have bid competitively.
have different banks trying to get our business.
So you understand why we didn't really get to financial policies and procedures. And they are gonna start, that was on our agenda too for Tuesday, but Cindy says it's kind of complicated right now. There's a lot of older policies and policies that they've added on to, so they're going through those and a long time before we get to them, so.
But at least this is one we'll create, and so we'll have,
Yes, we'll have one in there.
which
Thank you
I
for-
think we have talked multiple times over the same thing.
Yes,
But when we're all not here, having the structure of like written down and how these monies should be handled to make sure we're in a good financial position and being fiscally responsible, I think all this work will pay off. It's gonna pay off mainly for the people who take it on after us, but it will be good things.
and for the accreditation process,
Right.
that'll be.
kind of like the Constitution.
Yeah.
Thank you for all your input.
And now, I just want to clarify. So this meeting that we have, that's open to everybody, right? Because it's an actual scheduled meeting, right? So the other board members can come if they want to?
Just has
I'd have to post it.
Okay, so it's not actually posted?
No.
Okay, I just want to clarify.
And you need to make sure that everybody knows the date. That like January's meeting wasn't on the date it's supposed to be. It was a week later.
Right, but it's not an open meeting.
As long as there's
You don't-
two or less.
You
then
don't
they don't
inform
have
the
to.
rest of the
I
board,
think it was always
Meeting
the
changed.
second Tuesday.
but it was not.
It was on-
Tuesday.
Because of the weather, we moved it.
Oh, we
Oh.
moved it, okay.
So I guess, are we wanting to move? So I just understood like our committee meetings, we were generally not going to
I
have
thought we
them
didn't
open.
move it. We kept it.
Thought we moved it.
We were talking about moving it and then we kept it. We
Okay.
kept it.
So what do you-
We've had the same we've had the same date that we said we were gonna have it.
If we post it that we're having this meeting, then the general public can come and then
And we'll need to
we'd
do
have to open up
agendas
here.
and.
I get what you're
minutes.
saying.
I mean,
Okay.
This is our subcommittee.
Yeah, so this is
so I
probably,
thought this was, what I recall was having kind
I
of,
stayed out.
so we can make this unwieldy, or we can just do a brainstorming. So, yeah, I see what we're doing. Okay, that's fine.
I mean,
Just leave it the way it is. That's fine.
I think like this, we had some brainstorming, we talked about it, we brought it back to
Board.
the board as a whole. The board has given us some new things to look at. We'll go work on those and come back. That was what I understood we were trying, I mean,
I
this
like
is
it.
mainly, I'm looking at you because this was our discussions.
The brainstorming that goes on in the committee meetings is,
Trust me, it was
Right.
heavy duty.
but if there's a committee meeting that the committee feels more board members are needed to participate in, it's not that big a problem to post it.
No, and I think we can do that,
But-
I just don't know if we want every committee meeting to be
No.
that.
I wouldn't
We
say
just want to
it's-
Then it's
brainstorm.
called a board meeting.
Yeah.
Exactly. Special
So,
board
so then I
meetings.
guess for the other board members,
And this was a pretty heavy duty subject too, if you think about it.
Oh, yeah.
so
Yeah.
if you want to go to one of the
So that's
meetings
why-
or whatever, just call me so I don't go.
Right.
And then you two can go. Same with you guys. If you want to go to one of them, just let me know so I don't call in or.
And or if one of us is not available, who's on the committee,
Right.
for any committee, we
We
ought to.
can notify someone to go in our place.
Yeah, you're not gonna hurt my feelings if you want to go.
And let's not forget, I throw this out, I don't know why I'm thinking about it, that if down the road we have subcommittees or ad hoc committees, and if the board members are spread a little thin, we've got a lot of former board members that I think, really, we should not forget the assets that we have in this county of our former board members. The folks that, you know, if we have something that's gonna take a lot of time or a lot of work, I think that's why having the committee structures as we have in the new bylaws, it would encourage, we can have subject matter experts or community input.
Yeah, it's in there.
I don't think,
Speaking of bylaws, we need to have a meeting for that too.
Okay.
So I'd like to do that the first week of April, if possible. So
Any specific date or just first week of
first
April?
week of April, I would like to do it Thursday at 4. How
Okay.
would that, if you want to look at your calendars and I can,
So Cindy,
I will have to call in.
please look at the calendars and see if we can do Thursday, April 4th at 4 PM. And if we can, set up a bylaws meeting.
Y'all forms,
4:44.
4/4/24,
4:24.
4
At 4:00, yeah. So is that your best day then during the week that you can come?
Thursdays are always the best.
Thursdays is better. Okay.
Thursdays at 4, great.
Okay, text me whatever you guys finalize.
So 4 at 4.
If it works, just let me know.
Okay,
is that our annual meeting?
yeah.
So Cindy will set that up.
And do we all need to come to that, or is it that's just?
Just the bylaws.
Okay, okay.
And she's running it and then I'm on it, but once again, if somebody else wants to go, call me and you can go instead. I'm fine with that.
That's good.
I don't know that we'll have a lot since we just.
Just
You
redid
just,
them.
I would think it would be
But I think
There may
when
be.
we looked at the ones, you know,
Sometimes.
I do
Yeah.
think the annual review is important, and
Mhm.
even though we're not going a whole year, I think just let's get
in
this
the routine.
routine started,
Mhm,
that we're going to do this every April.
mhm.
So we actually call it bylaws committee or what do you actually call the meeting?
Bylaws committee.
Okay.
Because it's in the bylaws that the bylaws committee will meet at that in April.
Okay, I have it on my calendar. If you change it, let me know.
Okay,
Cool beans. Okay, next.
I think we can skip on down to review and approval of the bill.
What page are we on?
68, 69.
Any discrepancies or any concerns, guys?
Original mod, I feel very comfortable with them. I would make a motion to pay the bill.
Well, did we want to, on the Hunt County Board of Election, it's for 48,443.
Yes,
Okay, so that's because there were three candidates.
right.
Yeah, so actually, why don't we just explain to everybody kind of what happened, so.
So
Like, I didn't say this.
as everyone knows, this year we'll have 2 openings on the board. And so we actually ended up having 3 people signing up and then 1 person withdrew. And because of state law, and spoke to Chris at the election board and discussed it and politely disagreed with his interpretation, but basically his advice, and it was a civil conversation, but it was, you know, this is what we've always done and you can try to get an injunction. But
You're probably gonna lose.
yes, we have precedent showing that this is how this works. So even though the person withdrew before the sign-up period closed, we have to pay like it's on the ballot.
So will he be on the ballot?
No, just the 2 people for the 2 open spots.
That
Why not?
seems really unreasonable.
48,000.
And so,
$48,000.
but the problem is if we contested it, we would spend a lot of money to contest it and most likely we would lose anyway.
So I had a conversation with Jeff about this when he brought it to my attention, and I think the reduction from 48,000 was gonna be down to what, 20-something thousand?
So it still was gonna,
We're still gonna have to pay to have the ballots and those expenses done. We might be able to save 20,000, let's say it's 24,000. I guarantee you it's at least 15,000 in attorney fees.
so.
Well, the goal was to not have any expense, like we would just be scot clean. But I called too, I was trying to, that's already, we would lose. Yeah, there's already pre-existing case studies.
There's precedent
Yeah, we would lose.
showing that I mean, I don't
It's
like it.
debated
It doesn't make
things. Okay.
sense to me.
Now, the question I do have though, is can they back up that it's 48,000 for 43? Like they actually have the numbers to crunch to say, well, this is what it is. Sorry, too bad, so sad.
Yes.
They actually can show it.
Because they will show like, I mean, it's a big formula of every political subdivision that has things in different places, and, you know, they basically calculated out per each township or precinct how many things are on each ballot. And we
But
get,
are they charging per candidate or just the fact that we're on it, or how do they actually charge it?
it's based on how many ballot issues are on there and what our share is per each
So this will be
precinct.
on the ballot.
Regardless.
This election will be on the ballot when there's 2 open positions and 2 people are running.
So instead of getting the
Basically on the
minimum,
ballot.
because we had somebody put their name in and withdraw it.
Withdraw it, that's why it's on the ballot.
So, but at the end of the day, we should only be
We did it
paying,
before the
carrying our share of the total ballot costs that they incur.
So what was your question, Dr. Jackson?
So is there physically on the ballot?
That's
So
my
someone could
understanding.
write in other people
You could.
and somebody could lose.
You could. Because the way that it's been interpreted is because there were 3 people on there. I mean, we read the thing back and forth.
I called, I tried to get out of it, but
So will those 3 people be on the ballot?
there's only 2 people.
2.
So there'll be 2 spots open, 2 people.
But you could write it.
Yeah, there could be write-in votes too.
So they have to put it on the ballot. And there's a cost minimum that is calculated the way it is. What I was informed was that cost minimum is less than the 48, but the 48 is there because of the way it's generated in the beginning, that they were having to deal with people potentially being on or off the ballot. People can withdraw before they go to print the ballot.
So if only two people would have filed, it wouldn't be on the ballot.
Correct. Never would have been there to begin with.
Even though before the filing deadline, the person withdrew.
And the person that dropped out, I think he put his name in for a different election.
Yeah,
I would have
So
thought
that
that they
they
would have
got
had to be
charged-
on the
they got
ballot no
charged
matter
twice.
what for write-in purposes.
even if it's just two.
I would have thought that, but either way, we've got to pay, or we're
Yeah.
paying that or the attorney.
Then,
Then I did talk
I
to
don't even
Jen
sign.
and she said,
I'm sorry. I'm not
I
signing
mean, we
that.
could try.
Somebody
Well,
else
you
can
two guys
sign
sign
it.
it.
I'm not signing that. I refuse to sign that. I'm sorry. That's just ridiculous. I don't want my name on it. That's awful. I'm sorry.
Yeah.
It's just terrible.
You want me to, you really want me to sign?
Sure, I'll sign it.
Yes.
do you
I don't
want
want
me
my
to
name
get you
on
a picket sign?
Yes.
Dan will join you.
It's just stupid.
Does it matter which
That is a
line I sign?
significant waste of
It
money.
is,
No,
That's
and it
horrible.
doesn't cost them.
I'll just sign the first line.
I'm not signing.
And the guy that dropped out, he put us up, so he's gonna get charged twice then, right? For us and for the other thing that he put his name on too. Yeah,
so the election board is getting money. We need to.
okay, I'll sign it. This goes against my own better
That's
judgment.
awful.
We'll let
Where
the
do we
guys
find
do.
the statute? We can read it.
Dan,
That's just-
you are already following up with the board. Will you send them that too?
Yeah.
We'll send it to you.
So Jen Snyder thought that there might be some wording on it, but it's pretty straightforward. I didn't quite even see where she thought there might be some wording to get out of it.
I didn't understand her interpretation.
Yeah.
Except that it favored us, but that's not how I read it.
Right. And once again, we would spend all this money and then if we lost anyway, that makes it even worse.
We would have to demonstrate that what they're charging is not based upon the actual cost that they're incurring. They may, so we'd have to look at how they calculated it, but just because somebody withdrew, does that mean they can continue to say they have the expenses? There's that argument, so we'd have to look at their methodology.
That's what I was saying. So are they charging us because there's 2 people on the ballot or are they charging us because there were 3 people originally? And they're charging us 48,000 for 3 people. I just want to make sure that that number is truly the number.
It's
So
for
they-
the election.
They've already told us regardless, it is what it is. Too bad. Okay. That sucks. Sorry.
All on the record. Taxpayers are paying to be able to vote.
Well, taxpayers are gonna pay for it anyway, whether it's out of our budget, somebody else's budget, it's still being paid for, but it stinks that it comes out of our budget.
We're doing our job to try to keep things fiscally sound.
So,
And these are yours there, Dr. Kingsley.
all right, what's next? Oh, we still have to pay the bills.
Uh-huh.
Okay, so you made the motion to pay the bills?
I did.
Okay, who wants to second it?
I'll second that.
Susan seconds. Okay, any further discussion? Ready, Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Ken? Yes, I guess. So you're staying?
It is what it is.
As we close on this item down the road, when we do have elections, the Board of Elections should be able to provide us at our budgeting time, the rough estimate of anticipated costs for budgeting purposes, right?
And they did. I mean, that's,
And their cost to us in advance of knowing how many candidates was 48.
because it doesn't matter how
Okay.
many candidates, it's
Just
how many ballot issues we have.
Okay,
So if we had this and something else at a different date or on the same,
I think they have to put it on there no matter what, in case there are write-ins or if somebody becomes ill and withdraws from the race.
well, the state statute basically says if you don't have any more people sign up than positions open, you don't have to pay anybody.
Yeah.
So if
If
we
you-
only had the
Oh
two,
my gosh,
we
this
wouldn't
was
pay any.
$8,000.
Listen,
Him putting his,
Change your mind.
that person putting their name in,
Cost us $48,000. And then change their mind. Like if they would actually just stayed on, but he wanted to get on a different election thing, right? For mayor, Platte City or something.
He could be on both. There's no reason he
Yeah.
can't run for both.
So you could have made it.
I thought you couldn't run for 2.
Oh, no.
you can because there's, he actually knew that. He thought it would hurt his chances on the other, but he could have ran for both. He actually had discussions with the election board on.
Maybe it's like you can't run for the House of Representatives and
President.
And the president.
I think the statute, I don't know that you're allowed to hold from a county level up more than one elected position.
I guess we
Now, if
should,
you've got a township or a city, maybe that's different.
maybe we should just be thankful for all the years we didn't have to pay anything because nobody cared and before it never changed.
So there you go. So it's just averaged out to 1,000.
But it would be nice to know their actual algorithm, how they decide, how they figure what the cost is. That would be interesting to know.
Yeah, don't tell me how many voters are in
Is
each.
that like making sausage?
That's someone's salary for this year.
It would be nice to know.
You don't want to know the process.
I mean, because that's essentially $50,000 that we're putting for this stinks.
For nothing.
Could it go to help?
Pay off the bill.
Well, help healthcare delivery to people.
Okay, so it's just the one we have to sign?
Yeah, I think it's just one.
Okay.
And then there's the board. I think there's a board member.
I signed it.
You sign those? Okay, there you go.
What's on?
Fee resolutions.
All right. I think I got it.
Cindy, fee resolution?
Yeah, we added 2 labs this month. The air and culture sensitivity lab and a herpes lab, I believe. Yeah, a herpes lab with reflex.
And that's like a PCR, and is it like, what's the turnaround time, something like that? Is that what we're talking about here? Or what's up?
It's on Quest, isn't it? Or you using that Quest?
Quest, yeah, they had an old one, I think the old one was an IgM, they got with the reflex, they got rid of it, and all they have now available is just the IgG with the reflex, and, they were needing for a patient, so that's
So it's
what.
just immunoglobulin, it's not PCR.
Hmm.
It's immunoglobulin,
Oh,
it's not
yeah, yeah,
PCR.
yeah.
Okay, all right. What's the turnaround time of that? I'm just curious.
Pretty quickly, I think, they sent that to the lab and then they were calling back just to confirmatory because, it was an extra, they had to get permission to run it. And so it's the very next day.
Okay.
And it's an overnight.
So it's just IgG though? Because a lot of people have colds and they would be positive anyway.
Yeah.
Wow. It'd be nice, IgM would be better because then it would be an acute problem.
Yeah, and that's why they were trying to get that ordered, but still, for whatever reason, they're no longer offer that one at the Cost Laboratory that they're on Lenexa.
Okay, moving on to new business. We had talked about this, or actually Susan had talked about this at
Ahead
the
of
last
time.
meeting. But we have 2 more renewals, and I'll just kind of summarize the next 2 items. But we have 2 more 1-year renewals for our audit services agreement, which is for our annual audit with Kenny Hales. And then we have 2 more 1-year renewal periods with our banking, which we currently do through Central Bank. We know we get our lease purchase loan through Nottaway Valley, but our daily account stuff is through Central Bank. The recommendation from the Finance Committee, and Susan, if you want to say this, you're welcome to, but we recommended that we renew both of these for 1 more year for the Finance Committee to look at whether we would want to put it back out for bid or do that final year for next year. Because we just weren't going to have time. Both of these, I believe, begin in June. Is that right?
Yeah, the banking for sure, but specifically is would be very urgent.
So are we getting charged any extra for the auditing or is it the same price or?
I believe it's the same price. I
It's
don't
very
know.
close. I think they had some,
So there's is this it right here? So,
That's this year, 2023 items this year.
on page 78 at the bottom.
11,750.
$250 a year over the past 3 years. $250.
And compared to something else, it's
Compared
very,
to like what, and so I think I
Very
said
good.
like Andrew County was looking for someone. Not my county, the actual Andrew County. I'm not making it up.
I believe I've actually been through that. I know where it is.
But he said he was out there looking and like no one could touch this price. So he thought it was a pretty good price. They're a lot smaller, so I'm not sure how that factors into it. You would think smaller would be cheaper, but
Same.
Doesn't make any difference.
Same amount of work.
And are you their medical director? I thought I remembered, but. So I guess,
So we just need a motion to renew the current. I guess
to
I'll do it.
extend,
I'll do it. Okay, I make a motion to extend the current deals that we have, contracts that we have for one more year. And at that point, we reevaluate. Is that pretty much all you need?
yes,
Okay, do we have a second?
I second.
Okay, Kim's okay. Any further discussion? Anyone? No? Okay, Susan?
Yes.
Kim?
Yes.
Me? Yes. Mike?
Yes.
Ken? Yes. Okay. And then when we reevaluate this, what's the time? When are we gonna look at this again? Same time next year, or what are we looking at?
we will have a recommendation by this time next year.
Okay.
We'll be working on the summer committee as well.
And then need to do the same thing with the banking contract.
Okay, I'll make a motion again. So, make a motion that we extend another year with our current contract with Central Bank.
Yes.
And then, once again, we will evaluate a year from now. Second. Any further discussion?
Who seconded that?
Michael.
Okay, Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Ken? Yes, okay.
The next topic is Board of Trustees election costs. I think we will
I
skip
think
that.
we, yeah, I
Beat
think
that
we
one.
did. I
Beat
think
that,
we did
yeah.
earlier about that before.
And then our personnel action, you want to scroll down to that.
So this, was mentioned earlier, Frank Atkins has been hired as the part-time facility maintenance technician too, effective January 22nd. And he will be at scale 8, step and range 18R. His salary starting at $28.03 per hour.
And you explain again, what part-time is, what you told me what the schedule is.
20 hours a week,
20 hours.
Monday, Wednesday, and then we're flexing a little bit on our needs with him on Thursday and Friday, depending on what we have going on. So like he is actually going to be here for the harvesters distributions, which is Thursdays. So every second Thursday of the month, he'll be working that Thursday afternoon. Or is he doing like 10 to 2?
Yeah.
So he can be here to help with traffic for that. But then I think most of the other days he's here on Friday or other weeks.
And then is overtime available to him? And if so, what would that be?
He can work, there might be occasions where he'll work more than 20 hours per week, but he would not get paid time and a half unless he worked over 40 hours per week.
Okay, he's cool with that, you understand?
Yeah.
Okay,
Yeah, so yeah, it's just no overtime until you would hit 40. We don't have things budgeted for that, but you never know what could happen. So.
and he's flexible, it sounds like, which is pretty cool. So, okay, do we have a motion?
I would move to accept the personnel actions, Mr. Atkins, as presented.
I'll second that.
Any further discussion? Susan?
Yes.
Ken? Me, yes. Mike?
Yes.
Ken?
Yes.
All right.
So Cindy, do
One
you,
thing, we need to vote to accept the fee resolution.
oh, did we
Right,
not do that?
skip that one.
We talked about it, but we skipped it.
Okay, can you pop that up so we can see it? So we know what we're voting on,
Is that-
the fee resolution.
It's
That should be.
before,
Maybe
the-
when it's-
right before the contract or agreements.
Oh, might be in there. Did you sign for it, Kim?
I did.
Like,
Think it's
Dan, good eye.
supporting that.
Okay,
I think she's, was it in there?
yes.
All right.
So, do I need to read this then?
I guess just read kind of what
This fee schedule amends and supersedes the fee schedule adopted in paragraph 1 of the health service and vaccine fee schedule amended September 20th of 2011.
The schedule shall be effective on the first day of the month immediately following approval by the Board of Trustees and shall remain in effect until amended or repealed by the Board of Trustees.
And there should be a list and there should be a couple things highlighted.
It's urine culture and sensitivity and herpes IgG for 3 months.
And they were both increased in cost.
Yes.
They were added, they were brand new.
Brand new lab,
added.
that's right.
Okay.
Okay,
So I move that we accept the updated fee schedule and resolution.
with a second.
Shall I second?
Any further discussion? Anyone? Okay, Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Ken? Yes.
I believe that's everything.
Okay, nice work.
Do we have any closed session items?
Ta-da!
I can talk to you about this in closed session. I already got a beat on it.
Okay, so, I guess we need a motion to end the meeting.
I move that we end the meeting, February 15th.
Okay, and then the next meeting will be what day?
March 21st.
March 21st. We have a second?
I'll second.
Okay, any further discussion? No, Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yeah.
Ken? Okay, done deal. Thank you, everybody.
Done.
If I didn't know.
Yeah, stop recording.
We were gonna pay.
Regardless.
They are.
Yeah, yeah.